والثمرات وبشر الصابرين الذين إذا أصابتهم مصيبة قالوا إنا لله وإنا إليه راجعون. It's 2200 hours in Banjul. This is GRTS News broadcasting for viewers around the world. Our top stories this hour. His Excellency President Adama Barrow meets religious leaders and Al-Kalalu from Banjul and the Kanifing municipality at the State House in Banjul. Joining efforts to defeat household poverty, the Ministry of Gender and Children's Affairs partners with the United Nations Population Fund to boost domestic resilience. Inoculations to end the pandemic. More Gambians emerge to get vaccinated as officials expand the nationwide COVID-19 vaccination drive. Building peace ahead of the December 2021 elections, advocacy groups and activists intensify national peace-building efforts. In sports, Africa's track queen Gina Bass prepares for her debut 200 meters track field run at the Tokyo Olympics scheduled for Monday. Uganda receives more than 500,000 doses of COVID-19 vaccines from the Chinese and Norwegian governments as the East African country moves to expand its vaccination campaign. And Tunisian President Kais Saied meets the Saudi and Algerian foreign ministers amid the country's political deadlock. Well, details of that and much more coming ahead in the next 30 minutes. Thank you for staying with us. My name is Marian Ajayi and it's great to have you here. We begin with the President, His Excellency Adama Barrow, who spent a busy weekend at the State House meeting religious leaders and Al-Kalalu from Banjul and the Kanifing municipality. The delegation, which comprised several influential imams, was led by the Imam Ratib of Banjul, Alhaji Cherno Aliu Maska. The elders were at the State House on Sunday to reassure President Barrow and his government of their support and loyalty as the country inches closer to the presidential elections later this year. Well, let's now take a look at national efforts to end household poverty and promote women in the trade sector, which is gaining traction as women leaders in the area meet at a consultation conference organized by the Ministry of Gender, Children and Social Welfare in collaboration with the United Nations Population Fund. Thursday's forum at the Sadauda Karabah Center in Bijilo brought together stakeholders and partners to discuss issues affecting African women in trade and ways to defeat poverty.
African Women in Trade National Consultations Conference, organized by the Ministry of Gender, Children and Social Welfare in collaboration with UNDP, was on Thursday held at the Sadauda Karabah Center in Bijilo. The conference brought together stakeholders and partners to discuss African women in trade and defeating poverty. Speaking at the opening ceremony, the Minister of Gender, Children and Social Welfare, Fatou Sanyang Kinte, said the conference will increase support and sustainable continental free trade area.
The purpose of this conference is to interrogate the critical issues that should be included in this protocol by women exporters in the Gambia. So this is an opportunity for you to have critical input in shaping the content of the protocol. Your presence in this meeting is therefore very, very important. The Ministry of Gender, Children and Social Welfare will continue to facilitate efforts to ensure women-owned businesses have access to financial opportunities through the Women Enterprise Fund, which I mentioned earlier.
Minister Kinte further advised women to fully participate in trade to promote national development and entrepreneurship. Abdul Toure of UNDP noted that the conference will adequately create a platform to discuss on the economy of scale, success stories and challenges women face in the trade industry.
The free trade agreement is the world's largest free trade area with an estimated market of 1.2 billion people. The successful implementation of the trade agreement would be a key engine of economic growth, industrialization, and sustainable development in Africa.
Entrepreneurs, including Fatou Sambanjai and Fatima Jonkong Jame, shared their experience and how the conference has enhanced their professional skills.
I think today's was very important because they got to hear about some of the concerns and some of the problems, and most importantly recommendations, and once those are put in place, we should be able to facilitate business for us.
Reporting for GRTS News, I am Khadija Tujuara.
And now to the national vaccination campaign rolled out by authorities to stop the spread of COVID-19. The exercise is making progress across the country with record numbers emerging to get vaccinated. The one-shot Johnson & Johnson jab is currently being administered amid a surge in positive cases. Well, GRTS's Ibrahim Majalo examines how the vaccination campaign is unfolding amid misconceptions surrounding COVID-19 vaccines.
It's a fairly bright atmosphere in the metropolis, with a mixture of daily routine taking a new dimension in view of the COVID-19 pandemic. An increase in demand for the coronavirus vaccine is now visible at various vaccination centers in the Greater Banjul area, just a day after the Minister for Health, Ahmadu Lamin Samate, delivered a situational report indicating a surge in the number of cases. This is the Serekunda General Hospital in Kanifing. As of Friday, many people turn up here for the vaccine, despite speculations over the safety and efficacy of the immune booster. Many, including Martin Vaz and Lamin Ann, were afraid of taking the vaccine, but had to change their minds.
The first time they were taking it, I was so scared. So this second time when they called, I see a lot of staffs are coming in for it, so I decided to come. So I was so scared, I'm still young.
For me, if you see I come and take the vaccine, I trust the medical workers. But at the end of the day, no one knows what will happen, because any drug you see it's having side effect. Even the paracetamol that we are using is having side effect, and people are using it. But at the end of the day, you look at the greater good that will happen, the impact it will make in the near future. That's more important than the side effect that people are talking about, because there is nothing that is safe 100% in this world. Anything you see, it's having a good side and bad side. So whatsoever that come out of it, we will take it with good faith. But it's better to prevent ourselves at the end of the day.
Health experts say the vaccine does not prevent one from contracting the virus. So what is the essence of taking it? Omar Fofana, a clinical pharmacist, explains.
The advantages it has is that, number one, if you take the vaccine, even if you become positive, so there will be reduced need for hospitalization, and there will be reduced need for you having some severe infections. So taking the vaccine compared to somebody that doesn't take the vaccine, if you look at the studies, somebody that doesn't take the vaccine, if you are to be positive, so sometimes you can be hospitalized and you can be in critical conditions. So somebody that takes the vaccine, it will be very rare for you to see that person being hospitalized or in a very critical condition. And number two, the advantages or importance of taking the vaccine is that there's a reduced transmissibility.
One Maimuna Macaulay has also taken her dose of the Johnson & Johnson vaccine. She believes it's the best way to prevent herself from the deadly virus.
waaw nañ tray daal luñ mën a nekk ñu dem jëli ji ko ak suñ doom yi yëpp dem jël ko waaw gisuma si daal benn problème waaw soo ko jëlee daal di nga am sa jàmm ak sa wér gu yaram soo loolu dara gënu ko Gambien yëpp nañ jóg dem jëli vaccine bi.
Elsewhere in the Kanifing municipality, precisely opposite the Westfield Youth Monument, scores of people queue for the single shot of the J&J. Ramatulai Sise is the head of the vaccination team here.
So far, the turnout has been good. Since we started, and every day the turnout increased day by day. That means people are getting the information and they are coming as they are getting the information. The turnout is getting greater and greater every day.
Meanwhile, the Gambia government has announced a mandatory wearing of face masks in public as the fight against COVID-19 continues. Ibrahim Jallo, GRTS News.
And now the one-shot Johnson & Johnson jab is the dominant vaccine in the country, provided by the Biden administration's support to African countries under the COVAX initiative. Many African countries, including the Gambia, are now expanding the vaccination of their populations. Well, earlier, the manager of the expanded program for immunization, Dr. Sidat Fofana, spoke to Newsfile about the progress of the vaccination drive and how it's unfolding across the country. Let's take a listen.
An increase of cases of COVID-19 in the country, but equally we have received this American donation to COVAX facility, 151,200 doses. And as I'm talking to you, we roll it out on the 26th of this month, and we have seen tremendous improvement so far. Regional, the URR with 3,312 jabs given. CRR, we have 3,361 doses given. When you come to North Bank West, that's Farafenni, from Kerewan to Farafenni, you have North Bank West here, 5,312 doses given. You come to North Bank East, North Bank West is SAO Kerewan. That's 5,312. North Bank is from Kerewan up to Palodi, 3,718. You come to Western Region 1, that's Kanifing, 13,845 doses were given. You come to Western 2, that's from Brikama or Abuko towards Brikama. You have 10,252. So as a nation now, we stand at 43,555,000 doses that has been given. So that is tremendous. And definitely we want to urge the population to do. Looking at COVID-19, the negative impact is too much for a country, let alone a small country like Gambia. Yes.
Well, that is quite a massive number. So talk to us, Mr. Fofana, about the composition of the vaccination team. How prepared are they in terms of logistics and, of course, training?
Anytime we do a campaign in this country, it is always preceded by a micro-planning. And this micro-planning starts from the health facility upward. It's a bottom-up approach to such an extent that we try to consolidate this to national plan. This is what you normally go by. Training, that is usually followed by training at least a day or 2 days before the actual campaign, and that is what has been done. We train all the teams. We have 125 teams of 6 people. So you can imagine, each team will have 2 vaccinators, 2 recorders, and 2 canvassers. People who will go around to inform the people. Don't forget that. Yeah, this campaign is marred by a lot of misinformation, false rumors. But along the way, we have seen that now the reality has started to set in, and people are beginning to understand that this is serious. Close neighbors here, neighboring countries, we have seen people sick. The health system is overwhelmed.
Exactly.
Private system are overwhelmed. So the only thing that will save this country is for people to come up and take this jab. The Americans are really behind us, all our partners. They have given 151,000 doses, and tomorrow we are receiving equally at the same amount at the airport from the American COVID-19 Biden support. So this is a huge thing. If partners are coming to support us, try to prevent this country from the brink of COVID-19, the economic ramification, the social ramification, all those ramifications, which are impacting negatively on country's social life, religious, and everything. So if people are coming to give us their support, I think Gambians should be happy enough to make sure that we receive it. We must thank the American government through Pascal, their ambassador, the UNICEF, WHO, World Bank. They are all supporting these countries to make sure that at least people are safe. So that's a big thing.
Right. Now, where and when can we find the vaccination teams?
Exactly.
You know,
previously we wanted to do we normally have 2 strategies for our vaccination. That's the mobile and the static strategy. Okay. The mobile strategy now, most of the health facilities, if you go to any other health facility in this country, you are going to find a team there who will vaccinate you.
You will be vaccinated.
Yes. So at the same time also, we have mobile teams that will be moved from village to village. Like Serakunda, you cannot say Serakunda Health Center is going to be the only vaccination center. So teams will be moving from strategic location to another strategic location.
Depending on the population.
Depending on the exactly.
Right.
So that is what is the strategy.
Okay.
Yeah.
Now talk to us about the challenges. Of course, there will always be challenges, Mr. Fofana.
Yes. You know, the campaign is always rush. We plan, but that plan is always dictated by what is happening on the ground. When the cases started, sometimes we have to abandon this plan and take this. In the meantime, some of the logistics will not be readily available at that point in time. But we have seen this time around a lot of improvement. The only thing is this misinformation.
Okay.
Yes, and hesitancy. Okay. Still now you have people who don't believe that this disease is happening. They are not ready to take the vaccine. If you take it, you will die. A lot of rumors, and that's not the case. We have seen in this country, we have done it. All these developed countries, they all did it, and they are going out of it. So it's only the third world countries. So slightly we have slight concern, like fuel, beginning of the first 2 days, but now that is okay. So now partners are there, we have mobilities, and then, I mean, all the problems we are trying to counter them now, definitely. Yes.
Very well. Now, moving forward, what would be your message to, of course, the public, especially those that are still, of course, in denial? And interestingly, a lot of people will tell you, I don't think COVID is in Gambia anyway. They do believe it's actually, you know, in other countries, but not in Gambia for some reason. So what would be your message to the public?
Is to take this thing very seriously. COVID is in every country in the world. Bigger countries are suffering, let alone small countries. Exactly. Very resource-poor countries. If it's not the American and the COVAX facility, night now, Gambia will not have a single dose because there's a scramble for it. Big powers are going. You know, that's why Gavi, WHO, and the SEPI, that's the program for epidemic preparedness in the world, came together to form this COVAX facility to ensure that poor countries must also get their share. Otherwise, if you leave them, by the time the powerful countries are saying we are enough, the other ones will be finished. So that's how COVID came about. So in that regard, I want to tell everybody to ensure that your family, especially the elderly people, We have a lot of people with diabetes in this country. We have a lot of people with hypertension. The cancers are in these countries and all these respiratory problems. So usually children will have this, but it will not affect them. But if they go home, they can infect.
Exactly.
The teachers are also very high risk group in this country. One teacher will mingle with about 2,000, 3,000, 5,000 children.
Exactly.
They should try to come forward and take this vaccination. And the health workers, although we have seen a lot of improvement in them. So what the elderly people in this country and the teachers, the soldiers, the police, the immigration, all these are very high risk population alongside the health professionals.
And that was Dr. Sidat Fofana, manager of the National EPI program in the Gambia, talking to Aminata Isanyang and Fatu Janimbai yesterday on the news file. Now let's stay with COVID-19 vaccinations because medical doctor Sekou Manka is on the line to tell us more about ongoing efforts to curb the Delta variant and the importance of getting the vaccine. Good evening to you, Dr. Manka, and thank you for joining us on the news. Doctor, thank you for joining us on the news. Now, could you tell us how much is the Delta variant pressuring the healthcare system and why is vaccination very important?
Well, starting from the coronavirus, we first, before we talk about the Delta variant, we have to know how the coronavirus came into play, okay? Because initially we know that is the coronavirus and then it starts mutating. So we have different variants. So initially we have the Alpha variant and then we have the Delta variant, then the Gamma, and then, the current variant that we are facing right now. That's actually, the Delta variant.
And Doctor, can I just ask you, how is the Delta variant pressuring the healthcare system and why is vaccination important?
Yes, first of all, the Delta variant is very infectious. When it comes to epidemiologic time, when we say an infectious disease is very infectious, that means it is, the transmissibility is very high. That is, transmitting from one person to another is very high. And secondly, it is very serious. It comes with very serious infections. So, looking at our system, our health system, that is very fragile. So most of these people that are affected with the Delta variant, that are not infected, that are not vaccinated, most of them need the oxygen. And a country where there is no oxygen plant in the hospital, so it is very difficult for us to cope with it.
And
so that will,
yes, Doctor. So yes. Could we just take a look at vaccines and why it's important to get inoculated before one contracts or gets exposed to the virus?
Yeah, when we want to talk about the vaccine, the first thing is a vaccine, is a small portion of the virus itself. So what it does in the system is we provoke your immune system with the small portion of that virus, so that your immune system is going to build a different system against this particular disease. Like in this moment, majority of the cases are as a result of the Delta variant. So most of the people that are seriously ill are those that are not vaccinated.
Right. Now, how would extensive vaccination help to reduce the current pressure on our hospitals and healthcare system?
Yeah, this is a very important question. First, initially, most of the people are skeptical. Yes, they are skeptical about the vaccine.
Right.
Yes, because number one, the vaccine is not stopping you from getting the disease, but it will stop you from getting the severe form of the disease. So studies have shown that AstraZeneca vaccine and the JNT vaccine that we are receiving in country right now, they prevent you about 6% of the population from getting the disease, and also about 96% of the people of the population from getting severe illness. So you can see if we have at least 75% of the population or more that are vaccinated, then that is going to reduce the health sector, because the amount of people that will need oxygen that are infected with the virus will be very low, because those that are vaccinated have a very slim, they have a very percentage of getting the severe illness of the virus.
Right, right. Well,
so that's why mass vaccination is going to help us cope better.
Right, right. Well, many thanks to you, Doctor, for talking to us on GRTS News. And that was medical Dr. Seku Manka there speaking to us about the Delta variant and importance of getting vaccinated. And with that, we now take a short break and we'll return shortly after this break.
Miss Mam Georgia Jami, you're welcome to Tabokoto Outlet under the customer care and sales. I've been working with AfriCell for the past 14 years or so. Yeah, I first entered into AfriCell case in 2006, January 17. I am now an assistant manager for the sales and customer care. I'm much grateful to AfriCell management for believing in me up to this level. I would like to congratulate my fellow women on this day. We hope to be leaders of the Gambia.
Welcome back, and that was a short break there that we just had after talking to Dr. Manka there on the COVID-19 vaccinations. Now, welcome back. Uganda has received more than 500,000 doses of COVID-19 vaccines from the Chinese and Norwegian governments. The East African country has so far vaccinated 5% of its targeted population. Tunisia has undergone massive political transformation in the past week. President Kais Saied sacked the country's prime minister, froze parliament and assumed executive powers on Saturday. He met the foreign ministers of Saudi Arabia and Algeria to discuss the political crisis. Abel Hamid Chawzi reports.
تسييس الفيروس ومنشأه وحتى تسييس اللقاحات إلى آخره هو نوع من خلط الأولويات ويعني تعطيل عملية التضامن والتعاون الدولي من أجل مكافحة الوباء. الصين منذ البداية كان من الواضح أنها تعي مسؤوليتها بالمقارنة بموقف آخر، الموقف الأمريكي الذي يبحث دائما عن مصالح آنية دون أن يعني يهتم كثيرا بمصلحة المجتمع الدولي ككل.
اهتمام بعض الدول والقوى الدولية بالتركيز على منشأ الفيروس ويعني وضع نظريات وافتراضات قد لا تكون غير صحيحة هو في نوع من التشويش على جهود مكافحة الفيروس، ولكن الوقت ضيق جدا من أجل مكافحة الفيروس ومنع انتشاره وحماية أكبر قدر من أرواح البشر في أنحاء العالم، أرواحهم وصحتهم وهدر الموارد وهدر الاقتصادات، الأمر الذي تسبب في انتشار واستمرار الفيروس حتى الآن. الأولوية الآن للتكاتف الدولي.
This news bulletin with me, Mary Anjay Ajayi. Well, before we go, a quick look at the top stories once again. His Excellency President Adama Barrow has met religious leaders and alcalos from Banjul and the Kanifing municipality at the State House in Banjul. Now, joining efforts to defeat household poverty, the Ministry of Gender and Children's Affairs has partnered with United Nations Populations Fund to expand domestic resilience. Inoculations to end the pandemic. More Gambians are getting vaccinated as officials expand the nationwide COVID-19 vaccination drive. Building peace ahead of the December 2021 elections, advocacy groups and activists are intensifying national peace-building efforts. In sports, Africa's track queen Gina Bass is preparing for her debut 200 meters track field run at the Tokyo Olympics scheduled for Monday. Uganda has received more than 500,000 doses of COVID-19 vaccines from the Chinese and Norwegian governments as the East African country moves to expand its vaccination campaign. And Tunisian President Kais Saied has met the Saudi and Algerian foreign ministers amid the country's political deadlock. Well, that's it for now. On behalf of the entire news team, have a pleasant evening, but do join us again.
For the first time in the history of the Gambia, Gambia Printing Publishing Corporation proudly introduces the Biliomatic exercise book printing machine. The machine has the capacity to print more than 20,000 books per hour. Yes, 20,000 books per hour. It also prints magazines, newspapers, calendars, flyers, normal books and all kinds of printed documents plus items at affordable prices. With the Biliomatic printing machine, GPPC can now render high quality and non-size restricted printing service supply across the sub-region. Rush now and partner with GPPC for all your public and private printing service needs. Print with us today and you'd be offered highly professional, reliable and efficient service delivery by our team of experts. The Gambia Printing and Publishing Corporation is here to meet all demands and is reliable at all times. For more info, contact us on 437-4493 or 437-4402. GPPC is Gambian and it's yours.
For the first time in the Gambia, your favorite GSM operator, Africell, is the first and only GSM operator to launch a brand new technology called the eSIM. The eSIM simply means you can use your phone without a SIM card. Do you have an iPhone 11, any of the iPhone X series, a Google Pixel 3, or any new phone that supports the e-technology? Then walk into any Africell customer care center and activate your eSIM today. With your virtual Africell SIM, you can use more than one number without having a physical SIM card in your phone. Enjoy this brand new technology for the first time in the Gambia, brought to you by Africell. eSIM, your phone without a SIM card. For more information, please call 111. Where Africell goes, nobody dares to follow.
South Africa Global is the first and biggest